As an osteopath or a craniosacral therapist, you'll be well used to the fact that often you can get patients better very quickly, and other times they just don't respond at all. So what's going on there? That's what we're going to dig into in this tutorial today, and we're going to focus on one particular area. We're not going to look at the obvious stuff like, oh, well, that person had a bigger injury or they had a pre-existing condition. I want to talk about the nervous system and a particular incident that happens that fires off the nervous system and causes these patients not to respond. And let's use a case study example to do this, because that's a great way to learn. So the particular patient I'm thinking of, although this has happened with many patients I've seen, this one particular patient, I saw him about 8 years ago for the first time. Saw him a few times. He was a builder, various different things, normal low back kind of stuff that builders have got. He came in one time after a fall on his backside, responded very quickly to treatment, 2 treatments, absolutely fine, back on, full on, 100% in work. And then about 6 months later, I saw him again, and this time it was different. It didn't respond. I treated him, okay. I treated him the same kind of techniques, same way, no response. It's like, well, what's going on here? And the classic thing to do then is obviously to dig into the history a bit more. Did he have anything going on? Was there diabetes that had developed? Any chronic health conditions? Any emotional stuff that was going on in the family or surrounding or stress? All of the normal places you go to. Nothing particular. Now, when that happens, what you've got to do is double down on the history. You go back to the history and you go through it in detail. Now, of course, the patient won't want to do that. They're like, get on and treat me. I've already told you. Even if they're polite and don't say that to you, that's what they're thinking. So they'll just say, oh, well, I fell, I landed here on this bit here, and it was really sore, and I got up. And so with this particular incident, I went back and I said, right, okay, now I won't use his real name. Let's call him Peter. Peter, tell me what happened. I know you fell, and you said you were on that driveway, and it was slippy, and it was raining, and your feet went out from you, and you landed on your backside. But what else was going on? Were you in a bit of a rush? What were you actually doing? And when you do that, you're putting them back in that situation and you're getting more information out of them. Now, often a really good time to do that is when you've got them on the bench. Get them on the bench, work on them, and get your hands on and just say to them, just talk me through that again, the exact question I just asked, but while your hands are on the tissues. And he said, well, what I was doing is I was handing over the keys for this house. And I'm thinking, okay. I said, well, okay, well, just explain that to me a bit more, because I don't know anything about building. What do you mean? He said, oh, well, when you finish the building project, there's this little bit of this thing where you actually hand over the keys the very first time for that person to move into their house. I said, oh, that's cool. And I said, what happened? He said, well, I went to hand them the keys and my feet just went out from under me. They were a little bit lower than me, or it was on a driveway, new driveway, very slick, raining. They were slightly below him. They were trying to rush because it was raining, get them in the house, don't want dirty feet in the new house, brand new house. And as he went to hand him the keys, his legs went onto it and he landed on his backside. I said, okay, that must have been a bit embarrassing. And he said, oh, no, it was fine. I just jumped up and it was all fine, and I just gave him the keys and we just got on with it. Bang. That's the light bulb moment. And I want you to remember this. What happened was he jumped up immediately, and even he's saying to me now, oh, it was absolutely fine. I was all good, even though he's obviously not. I mean, this is a couple of treatments down the line. A few weeks have gone and he's not all right. But what happened was he jumped up and carried on as if it was all okay. And you'll meet people that do this. I mean, it's a natural thing. Let's say you fall or stumble in a crowd, you're in a restaurant, you slip off the chair. Somebody's done that silly thing where they pull the chair out thinking it's a bit of a laugh. Happens in school a lot. I remember all the time. People are pulling out chairs and kids landing on their backside. Very important when they're young. That sacrum hasn't fused yet, still in 5 pieces, so it can move a lot more easily, get a lot more interosseous strains and problems through that area. But let's say something like this happens. It's embarrassing. So what do people do? They jump up, and often they'll pretend that nothing's happened. Oh no, I'm good, I'm all fine, which is what this person said. Now, what is that telling the nervous system? It's telling the nervous system, I'm all good, even though you're not. Now, if we come back to caveman time and go to saber-toothed tigers and things where you're out in the wild, our body is still primed a little bit like that. And so what would happen is, if you took an injury, you're running away and you got slammed into a tree as you're trying to get away from a tiger, you gouge this big thing out of your arm, it's bleeding, you don't stop and go, oh wow, that's a bit of a problem, better lie there and patch it up. You run like crazy, get in the cave, get somewhere safe, climb a tree. And tigers climb trees, I don't know. But you get somewhere safe And only when you are safe do you look at the injury. Do you allow the body to start treating the injury, whether you patch it up first aid or whether you just collapse in a heap and whoom. And what used to happen, and it's become a bit of a therapy now recently, a way of treating, is this shaking. Is that you'll go into this shock, this shaking, and what's happening is you're getting rid of all that excess adrenaline. And you see cats and animals do this as well. After that close shave, you'll see them do this shake. They're getting rid of that adrenaline. They're telling the body, okay, that's all gone now. You can switch now from that real fear, adrenaline state over into that more calm, healing, recovery, parasympathetic nervous system state. Now what happens is that in these days, where we're a little bit out of touch with our body and our body is overridden by our minds and we're in constant stimulus, whether it's in traffic, Facebook, advertising, commercials, people in our face all the time, we're in a really heightened state of adrenaline. So it's much harder for the body to control that switch from the adrenaline to the non-adrenaline state. And what happens is when you have an injury like this, where you jump up and you're, oh no, I'm all right, I'm absolutely fine. Obviously you're telling everybody else that, but also your mind is communicating to your body saying, it's saying I'm all right. The body goes, I know I'm not all right, I've just taken an injury, but I get the instructions. The instructions are saying to me, carry on regardless. There's a tiger chasing me, just get on with it. Doesn't matter if my arm is falling off, and I'm certainly not going to stop for a silly little land on my backside. And so what happens is you're in that adrenaline mode where you're just going to go. You're just going to go until you drop dead, or you reach a place where you can get recovery. So off you go, body locks down, you keep going. And that's what this person did. He just carried on, gave them the keys, showed them around the house, got home that evening, was like, oh, I'm a bit sore. But here's where the problem is. The body has not been told to switch from that adrenaline state into that healing state. It doesn't know now that the tiger isn't chasing them, that the problem isn't there anymore, because you've had 3 or 4 hours or 5 or 6 hours of going, I'm all right, I'm all right, I'm all right. You see people human beings do remarkable things when they need to, in terms of endurance, Olympics, all sorts of crazy stuff they can do, overcoming pain. The mind is incredible at that. The body is incredible at that. So you just push through. And with all the other things I said about the way our mind and body are not connected the way they used to be, in tune with that, what happens is the body doesn't know, it doesn't get the signal to heal. And so they come and see you 4 or 5 days later, and they're stiff and they're sore and they're in pain and their SIJ joint is playing up and they're like, can you fix me? And you start to get in and doing techniques. You might mobilize, you might use other techniques, you might even just from seeing what's going on, more of a CSD style, a cranial style technique, functional, whatever. You're doing this and the body's just flat rejecting it. Ain't interested, ain't interested, ain't interested. It appears to be compliant. You can move them around, they're not resisting you and they're not holding themselves rigid, but it just doesn't take, because the body is still had this really strong command right at the start to not go into healing, to stay in that fight-flight system, to stay really, in that adrenaline state. And so what happens is it just rejects all the help you're giving it, because it doesn't want to go into that vegetative healing state. And so with this thing, what you have to do is you have to get them into that state. And so always I encourage people, when you're treating someone, obviously that little bit of listening first, that little bit of listening to the body to see what's going on, to see if you're getting a response. You can always move into stronger, more mechanical treatments, structural treatments afterwards, but have that little bit of listening first. Then when you start to do your treatment, you might feel that you're a little bit more in tune, the body has listened to you a little bit more, and you get that better connection, because it's about connection. But it's also about testing, retesting all the time. You don't give your whole treatment, stand up at the end, see how you are. Whoops, they're not any better. Okay, well, just do your exercises, I'll see you in 3 days' time. No, you're mini testing all the way through. You're doing a little bit, you're then retesting to see if they've got a better movement. Maybe you sit them up, maybe you stand them up. So you're doing these segmental little treatments, 5 minutes, 5 minutes, 5 minutes, 5 minutes, so that you can course adjust. You do a 5-minute treatment and it's not getting anywhere, then you've got to think, okay, well, I remember that video Jonathan was talking about, maybe I need a different approach here. What you do, you then talk to them about that injury, their history, try to get a little bit more out of them. You acknowledge that back to the body, and I've talked about that in lots of other videos, acknowledgement, connection, and then you get that body going, and it actually feels like that. It feels like it's going, the whole nervous system feels like it's just dropping, like the elevator just going, boom, landing, woof. We've moved the patient, or the patients move themselves with our help, with our fulcrum, from that fight-flight system, that adrenaline system, into that healing state. They come down, and then the technique you use is less important. Probably all of them will work. And so that's the difference. That's the difference between the patient that you treat, exactly the same patient. It can be exactly the same condition, might be 2 or 3 weeks apart, and it's not because they've had the one injury and then the other one follows up. You've cleared that one up. Same injury, the one responds, one doesn't, because of this lockdown nervous system. And usually it comes with being injured in front of other people in an embarrassing situation, which doubles down on the fact you don't just kind of get up and go, get on with it, like a kid, they fall off their bike and they're like, I'm all right. They get up, they double down, and they tell everybody around, I'm all good, and off they go. Now, the other time, I'm going to mention one other incident where it tends to happen is that you can have, and what happened with the kid there I was talking about reminded me, so you get this in children quite often, is like they have a fall off their bike, they're down at the play yard, down the end of the street, they kind of hobble back and they're like, they kind of keep the half crying, keeping it together, come home, ready to unload on their parents, and this is what happened. They get home, nobody's home. Or their dad's on the phone, or mum's on the phone, and they can't give them the attention they need. They're waiting, it's held, it's waiting to burst, it's waiting to release all that emotion, and no one's there to release it for them, to help them release it. And then they double down, it gets locked down, and a similar thing happens. Similar thing, you've got to acknowledge that. With kids, it's huge like that. Maybe they were pushed over in the playground. Mum and dad doesn't even know about it. They're just like, John's complaining of a sore back. He was pushed over in the playground 2 days ago. Yes, it hurt, but it was the embarrassment of being pushed by the bully. And then he had to jump up and pretend it was all right. Or they didn't jump up, it was just the kind of whole thing of, look at that person there. So this emotional aspect is really key. And it's so easy to check for this. Now that you know about it, you just do a little bit of listening, you have that intent of waiting, seeing if there's something going on. Maybe you ask them a little bit about the history, and then you start the treatment. If the treatment doesn't go well, you back up a little bit and try this other approach. There's 1,000 reasons why some patients get better and some people don't, but this is a key reason why it happens to a lot of them. And it's also a key reason why you might get a patient better for a couple of days and then they get worse again. You're kind of playing on the surface, and underneath they still haven't got that healing system going, and so they're not able to work with what you're giving them. Normally what happens, you work on a patient, you make great change, or some change, let's say, they go out and they take your change and they get better and better because they're working with it. They have a natural healing system to help them with that. If a natural healing system is locked down, it's going to be real trouble. You see this in babies as well. Trauma from birth gets all locked down. Got to get that emotional side lifted. You've got to get that fear. Oh my God, what's this world all about? Get that to lift, and then we can get on and do the rest of the treatments. So just hit the subscribe button if you like this. It tells me to produce more material like this. And there's plenty of other videos for you to learn on here on this channel. Treating adults, treating babies, 2 playlists here for you to check out.